Welcome to Nurses Uncorked, where I pour out the unfiltered truth about healthcare life. I'm your host, Nurse Erica, serving up real talk straight from the front lines to your ears. Each episode, I'm uncorking conversations that matter to nurses everywhere, from the hilarious to the heartbreaking, the inspiring to the infuriating. No filters, just authentic nursing experience shared with a splash of humor and a dose of honesty. So grab your favorite beverage, put your feet up, I know they're tired, and join me as we uncork another episode of Healthcare Reality. Now let's get this shift started. Welcome back to Nurses Uncorked, where we open up the conversation about nursing, healthcare, and everything in between. I'm your host, Nurse Erica, and today we have a very inspirational guest joining the podcast, Amy Siple. She is the nurse practitioner who is courageously taking on the Kansas Board of Nursing. You may have seen a couple social media posts I've done about this recently. She's the Board of Nursing claimed she was practicing without a license because she failed to renew her nursing license. Amy denies that. She says that she thought she had renewed it, but didn't. It was at a time where she was not working, was not treating patients, was home taking care of her sick husband who had been diagnosed with cancer. It has turned into a major, major story out there and really has the potential to lead to the overhaul of boards of nursing everywhere. And she has graciously agreed to share her entire story and everything that she has learned with all of us here today. Before we get into it, a quick reminder to sign up for automatic downloads wherever you listen to podcasts. That really does help a lot. If you enjoy the content that I put out, consider becoming a patron for as little as $5 a month. There is a link in the show notes. And don't forget to share Nurses Uncorked with your coworkers, your friends, your family, and leave a review. All right, let's get into it. Welcome back to another episode of Nurses Uncorked. We have a very timely in the headlines episode for you guys today. We have Amy Siple, a national speaker and author on healthcare issues that impact older adults and the empowerment of healthcare givers. She has served the primary care needs of older adults for over 25 years. Under her leadership as president of the Kansas Advanced Practice Nurses Association, Kansas became the 26th state to pass full practice authority for APRNs in 2022. Amy is also a TEDx speaker and content expert for Project Echo. She lives in Kansas and has been married to the man of her dreams for over 33 years. Back in 2024, she was accused of unprofessional conduct by the Kansas Board of Nursing. They claimed that she was practicing without a nursing license. However, Amy claims that she simply forgot to renew her license because she was caring for her sick husband who had been diagnosed with cancer, and she was not treating any patients at the time. You have probably seen me posting about Amy's case on social media, and I reached out to her, and today we are going to hear the entire story from Amy herself. So welcome to Nurses Uncorked, Amy.
Thank you. It's my pleasure to be here.
I'm so excited to do this. I've had a lot of interest and feedback in your case when I started talking about it. I think that I actually read in an article someone that used this great quote. It's opened the Pandora's box of corruption in boards of nursing. And so I think now, little by little, nurses in every state are kind of opening the door going, wait, that happened to me too, But yeah.
Like people contact me every day, almost daily, from around the nation, telling me their stories. This is very prevalent, and most cases are far more egregious than mine.
For those that may not know you, can you share a little bit about your background as an RN and a nurse practitioner in Kansas and what kind of work you've spent your career focusing on?
Sure. I have a God-given love for people, and I really enjoy science and problem solving. So nursing was a natural fit for me. I became an RN back in 1992, and I started out my career on the peds floor, pediatrics, did some PICU and pediatric oncology.
Me
And
too.
I just felt like I wanted to have a bigger influence over some of the decisions. And so I went back to school and became a nurse practitioner, and I graduated in 1999. I got my FNP but I was really drawn to that older adult population. I loved the complexity of multiple comorbidities and multiple meds and just balancing that. And I just saw it as an underserved population. I was really drawn to the dementia realm because this is such an underserved population and they're just misunderstood and so often, chemically restrained. And so I really moved into that space. So I became a certified gerontologic specialist and did a lot of my work just around older adult care. And then I figured out if I wanted to make a bigger impact, I should try to influence the next generation of nurses. So I
Yes.
became an associate professor and I was in that role for probably 15 years, but I continued to work as a nurse practitioner that entire time. And I was named professor of the year and God has just given me tons of leadership opportunities. I've volunteered on multiple boards within the state of Kansas. I've been published and TEDx speaking, and I speak around the nation. I became very successful in helping turn long-term care facilities around. Facilities who have a low star rating because they've got a lot of falls or a lot of psychotropics, coming in and working with the staff and working with the clients and the pharmacists and moving them up that star rating system to the point that I'm asked to speak about that all over the nation. So that's kind of been where I've been with nursing. I've never been sued. I've never had any complaints filed against me. Just a really clean record and lots of opportunities in service. I was appointed to be the on the very first Alzheimer's disease task force for the state of Kansas. I'm the chair for the Kansas Board of Adult Care Home Executives. It's been a wonderful career.
I'll have to pick your brain a little bit after
Sure.
the podcast because I'm dealing with some of your specialty in
Okay.
my personal life. But can you walk us through what happened with your nursing license? It's not that you decided to not renew it. In
No,
fact,
no.
you thought you had renewed it. What
Hmm.
happened?
Sure. So the practice that I had worked for, I don't know, probably almost 20 years, sold out to a large conglomerate, and I decided not to join the new group. So it was the first time I wasn't employed as a nurse practitioner since I got that license back in 99. Because at the same time, not only did I not want to work for this like large corporation, I wanted to have individualized care, but my husband, he was sick. And so, there was evidence that he probably had cancer. He's a captain on the fire department, and firefighters have high rates of cancer and sometimes poor outcomes. And so I just wanted to take a step back from practice and walk with him through this journey. So I was rendering care to him. I wasn't employed at the time, and I didn't receive a renewal reminder. And I know it's my responsibility to renew my license. It just wasn't on my radar, and
Right.
I wasn't employed in practice. It's the first time in my whole career I haven't been employed in practice. And so then, after his surgery and he had stabilized, I was ready to get back to work. And so my license renewal my deadline was May 31st. So I became unlicensed, I guess, on June 1st, you would say. Now,
Hmm.
my education hours were all up to date. They were all current prior to the deadline. My malpractice has never lapsed. So the only thing I'm deficient in is paying them. It's just paying them.
Hmm.
That's it. So then in October, I'm ready to get back to work. But before I start applying for jobs, I'm thinking, did I renew my license? I mean, I know it's
Right.
this year. I just can't remember if I did it or not. I mean, that was just such a blur that whole season with him being sick. And so I go online, and much to my shock, I had just failed to renew. And it's the first time in 32 years I had not renewed on time. So I contacted the Board of Nursing, and I fully expected to pay a late fee. I just had no idea what they had in store for me.
And I shared this with you, but I want to share it with our listeners for any holier than thou nurses out there that think it's your professional responsibility. It is, absolutely. And
Mhm,
I personally don't know that boards are obligated to send us reminders. Mine does not. It is our responsibility. I agree.
mhm,
But I will tell you that it happened to me when I
mhm,
was a fairly new nurse. It was maybe my second or third time renewing.
mhm,
I was going through a divorce and life was lifing hard at that time.
right.
And I knew it was coming up and I kept saying, you need to do this, you need to do this. And then somehow or another, the week of, it just was not on my radar at all because of everything that was going on. Well, in my state, they expire on your birthday, and I
Mhm.
had to work on my birthday because nursing. And so I show up to work, it's a few minutes before 7 a.m., and someone says, "Oh, happy birthday, Erica." And it was like, ding, ding, ding. It reminded me immediately, "Oh, today's my birthday." And I didn't, oh my God. So I made up some excuse before getting report, went and hopped on a computer and renewed it really quickly. Thank God in Nevada, we don't have to individually scan in all of our CEUs. I had them, but we don't have to do that. It's a, honor system basically, and they can audit you. So I was able to do it rather quickly. 10 minutes later, I would have been receiving report and working without a license basically. But by the grace of God, I
Mhm.
was able to get that done. So it happens. It happens, even to the best of us. How did the Kansas Board of Nursing initially respond to you when you didn't renew your RN license? I know the term unprofessional conduct is crucial here. So tell us how that played out.
So I contacted them, and said, I didn't pay you on time. Do I have a late fee or what do I need to do? Here's evidence of all my education and my malpractice. And what I've learned is they don't tell you that you're under investigation. So I am freely talking to them, not understanding
Yeah.
that they are looking for anything they can use against me.
And
And
documenting it or possibly
yes,
recording it.
yes,
Yes.
exactly. And that's what nurses need to understand. Whenever you talk to the Board of Nursing, they are not your friends. They're gonna sound like your friends when they talk to you, and nurses are used to speaking freely and just giving data. I mean, but I wanna encourage you to think like you're talking to an attorney. So
Yes.
that's the advice I would give to nurses. If you're ever talking to the Board of Nursing, the less that you say, the better. Pretend like you're speaking to an attorney that is out to get you, because they are. And so I made a lot of mistakes in that process. Just I think just speaking so freely, not securing an attorney. I just thought they just don't understand. I mean, if they
Yeah.
understood, no patients were harmed. I mean, I wasn't even employed in practice. This is just a misunderstanding. Where's my late fee? I just but they said that I needed to, well, they don't tell you this. So here's the thing nurses really need to know is they're going to ask you, "Okay, just sign this consent agreement." If you
Yes.
sign this consent
Which
agreement,
sounds so innocent, a
it
consent
does,
agreement.
and
Yeah.
pay this small fee, then we'll get you reinstated. And that's what they told me. They said, "It's just like a traffic ticket. It's no big deal." So I'm
Oh,
writing up
yes, it
10
is.
consent agreements a week. It's really no big deal. That's what their attorney told me. Um, but fortunately, I knew a little bit and I had done a little bit of research. And so I said, "So you're not going to put me on the databases then?" And they're like, uh, well, we don't have a choice about that." So they don't tell you that that's what their plan is, but their plan is public shaming. Their plan
Mhm.
is to discipline you. And part of that discipline includes a public shaming process in which you will go on 3 databases at least, maybe more, and their newsletter in Kansas in perpetuity even after you die.
Yeah.
And I just read an ad for a nurse, position in the paper just yesterday that said, "We do not accept applicants who have
Mhm.
been disciplined by the Board of Nursing." And you
I've
need to
seen listings like that. That's not uncommon. Yeah.
right, and as you have to have malpractice insurance for sure as a nurse practitioner,
Mhm.
in our state, it's required, but your malpractice company will likely cancel you if you've been labeled as unprofessional, or you may get quadruple the rates. They don't tell you all of this is going to happen. Getting hospital privileges will be hard, getting jobs is going to be hard. Insurance companies might drop you. They don't tell you all of this when they try to get you to sign that consent agreement.
Right. And when they call you, or in your case, you called them, and you find out, usually it's a nurse on the other end that you end up, not always, but usually it's a nurse that's an investigator with the Board of Nursing. And you think, because this has happened to me, I was reported once. And so they call you and it seems very innocent. "Hey, this is so and so. I'm a nurse with a Nevada, State Board of Nursing in my case. So we received a complaint. They almost like downplay it. Like they
Yeah.
know that it's ridiculous is how it comes across. I
Mhm,
received this complaint and so, we have to reach out to you for a statement. Can you tell me what happened? And you think, okay, it's a nurse. Like they'll understand. Let me just tell
mhm,
them what happened and surely they will get it because I'm speaking nurse to a nurse, right?
mhm, mhm.
What they don't say is, just like you had mentioned, they're absolutely recording this, they're taking notes. It can and will be used against you just like we hear all the time the cliche. And so I always tell nurses, if you get that call, because it's almost always without any warning. You're going to
Right,
be in line at the grocery store, call from an unknown number, you answer, you're not thinking much of it. And so you start talking freely. What you need to say is, am I under investigation? And if they answer yes, or it could be, we don't know yet, anything like that, you need to say, okay, it's my intention to cooperate fully with any investigation. However, I will be obtaining legal counsel and they will be reaching out to you and speaking to you on my behalf. And
right.
that's it. Do not get baited into anything else and lawyer up
Yes,
immediately.
I
Yeah,
agree. And most people don't realize that if you have malpractice insurance, most malpractice insurance just have a rider that is for license protection. And in fact, do not take out malpractice insurance if you don't have a rider for your license protection, because you're about 90% more likely to face board discipline than you are to be sued in court. So it is, you really need your malpractice insurance, I think, is almost primarily for the board discipline cases, because that you can lose your license over that.
absolutely. I say that all the time. Not only does everybody need their own liability or malpractice insurance, no matter what, even if you're not bedside, you need that as a nurse.
Mhm.
Uh, Always. And, there's lots that specialize in this, but you can also get it through your like homeowner's insurance policy, often car insurance company, that sort of thing. There's lots of different ways to do this, but you always want to make sure that it covers Board of Nursing issues. Very,
Right. And
very,
so
very important.
and if the board contacts you, contact your malpractice provider first and ask them if there's an attorney that they work with. You just want to make
Yes.
sure that you're using an approved attorney so that they will cover those expenses. I mean, my attorney's $450 an hour. And my case has been going on for, I don't know, almost a year and a half. I mean, how long could I afford that on my own?
Right.
So this is critically important.
It is. What were the first signs to you that this was going to escalate into something bigger than just a Board of Nursing issue?
Right. Whenever I received a letter that and this was during the week of Thanksgiving, I received a letter from the Board of Nursing saying that I would need to sign the consent agreement by the following Monday. So I had not secured an attorney because I just thought they just don't understand. I mean, as soon as I can talk to people, they'll figure out. I mean, this is kind of just, give me my fine and let's be done with this. What is going on here? It just didn't make any sense to me. Um, but so I secured an attorney, and actually prior to that, let me just say prior to that, I filled out an open records request. So I
Okay.
said, "I don't even know what you're coming after me for." So I filled out an open records request and I said, "I would like all information pertaining to that includes my case number or my name, all communications between staff, board minutes, anything that includes that information." And I got a letter back from the Kansas State Board of Nursing saying, "We do not have to comply with the Open Records Act because you're under investigation." So that was a huge clue there. I'm
Huge
like,
red flag.
what? And so, now I'm sensing their level of hostility is coming out now. And then I found out that the man that I talked to on the phone was not even a nurse that investigated me.
Mm,
And so then I get that letter, and so I meet with my attorney the Monday after Thanksgiving. And so I found him on Friday after Thanksgiving. I mean, I just have no
mm.
time to try to find
Right.
an attorney, and you're like thinking I
You're supposed to be watching the parade, eating leftovers, and Black Friday shopping.
and cooking for your whole family.
Yeah.
Yes. And so I met with my attorney, and he called the board of nursing that Monday morning after Thanksgiving and said, "I'm meeting with my new client. Can you please send over her file because I don't even know what I'm defending here." And
Hmm.
they refused to send over my file
How
or the
can
open
they
records
do
request.
that?
I don't know. They didn't turn over my file until a judge mandated they do it. The administrative law judge mandated they do it, and that wasn't until I think the end of May.
That's unbelievable. Are they not obligated? I mean, I know administrative law is completely different, and boards of nursing fall under administrative law. It's completely
Yes.
different. People don't
Yes.
understand that. But do
Yes.
they not have like a discovery process where they have to disclose, especially to an attorney formally requesting
You would think. I mean, I
it?
think my attorney was trying to play nice in the beginning, thinking once again that, okay, we can work this out. I mean, there's a level of reasonability here when they figure out who she is and, just that she hasn't harmed anybody. I think he assumed, let's just play nice. And so he wasn't playing hardball with them until eventually he told me they're out for your total destruction.
Yeah.
And he told me, he said, you can fight them and he did tell me when I first signed on with him, and I heard this from lots of people, that the board of nursing is the most maniacal, vindictive board there is. And they said,
Yes.
all the attorneys have said that. And so all the nurses that have called into me who contacted attorneys, 100% of the attorneys will tell them this is the most maniacal, vindictive board in Kansas. And so my attorney said, if you decide you want to fight them, you can be the sacrificial lamb, and you may be able to affect change for the next generation because you've got a lot of legislative connections. But you just need to understand they're out for your destruction, and you may pay a very heavy toll to do this.
Well, yes, and kudos to your attorney for at least painting that picture for you of the
Mhm.
risk and that there is opportunity potentially for change. And I just want to say a quick disclaimer, not every board of nursing is horrible. They all operate individually in a silo, but a lot of them are extremely problematic. I personally don't think my board of nursing is that terrible, and I don't just say that because I don't want them to come after me. I hear very few complaints about my board of nursing, but Kansas, Tennessee, California, a, a day does not go by where I do not hear from nurses with horror stories dealing with their board of nursing. And it never involves something like patient harm. Never. It's always some silly little thing. But okay, so from that point and then up until the House Select Committee gets involved, what happened in that interim there? Was there a hearing with the board? What happened?
No, so I began hearing about it. So I went to the press. I started talking, and I have a lot of legislative connections because I helped get full practice authority through just a few years ago. So I know a lot of those people, and they
Yeah.
know me. And I've even taken care of legislators' families. I mean, they know who I am. So I reached out to some of them, and I reached out to the press, and then other nurses started contacting me. And when I started
Smart.
hearing other people's cases, I realized mine was the least egregious out there. And everybody, I mean, the horror stories that I would hear, I mean, people taking their life over this, nurses
Yes.
absolutely killing themselves. I mean, this is just so, so tragic. Um, and so that I knew that I had to stay in this fight, regardless of the outcome, regardless of the consequence. I was not going to back down from this. And so I really respect our Speaker of the House. I've got a good relationship with him through working on other issues. And he had a meeting with me, and I talked to him about my story, and he knows me personally. He knows me as an
Mhm.
individual, he knows my character. And so I think that helps. So it's not just some random nurse contacting them. This is somebody that they knew. And I was able to introduce him and other legislators to other nurses who had been impacted. And the great
Yeah.
thing, nurses keep good data. So
Yes.
anytime a nurse calls me and tells me their story, they'll send me the data, they'll send me the documentation so that I can confirm that what they're saying is legit. We want to make sure that we're representing. I've had some nurses call me that I'm obviously not going to be able to support because they have committed egregious acts. But the vast majority, like you said, 90% are clerical errors, or
Mhm.
they've
Something
been turned in by somebody who was angry with them. Like this one nurse practitioner, she didn't have enough room in her schedule, and so because her schedule was packed, so she sent this patient to the ER to be seen, and they turned her into the board of nursing. She's under investigation for 4 years. Well, I mean, her schedule is
for
full.
what?
Unprofessional conduct. I mean,
Uh,
it's just, it doesn't make any sense. Or people being turned in for drug diversion by
mhm.
somebody who was mad because they didn't prescribe a narcotic, and yet this nurse has tested negative on every drug test, multiple
Yeah.
drug tests, and they're stuck in this program for 2.5 years. They can't get out even though they've never had
Yes.
a positive test.
Yes.
And it's just they assume that you're guilty until, I mean, they just assume you're guilty. That's just all there
Mhm.
is to it.
Yeah, some states have huge problems with the drug programs, the volunteer, programs that they put you in, especially California. Did an episode on that a long time ago. They will be stuck in these programs for years and they
Yes.
keep moving the goalpost and it
Yeah.
costs them thousands of dollars. Some are living in their
Yes.
car, they've gotten
Right.
divorced, they cannot get out of the program. They've done everything on the list 300 times over and they
Yes.
cannot get out. It's terrible and
And if they
punitive.
do leave the program, then their license is revoked and they're turned over to the Office of Inspector General. And then at that
Yes.
point, you can't be licensed for anything else and you're flagged on all background checks. So they've
Yes.
got you. I mean, the corruption is so deep and they make a lot of
Yes.
money off of this.
Mhm. Okay, so then explain to us the process because you were very creative, and I want nurses to pay attention to this. You really you kinda went around things and you thought outside the box on how you could deal with this. So how did the issue move from the Board of Nursing to the Kansas House Select Committee on Government Oversight?
Well, and I think part of that is you have to care more about the cause than you do your case.
Yes.
If my goal was just to keep myself safe, then I would not have done this. But
Right.
if you care about the cause, and for me personally, I'm somebody of deep faith. I mean, I just feel like God has called me to do the right thing, and I'm going to do the right thing and let the cards fall where they may. And I know that this is a very just cause, and so I'm in it. And so nurses started calling me and I encouraged them to tell their stories. Now for every one person that will tell their story, a dozen more are too afraid. They're all afraid of
Correct.
retaliation. 100% of them told me they're afraid of retaliation. And
Uh-huh.
in fact, in one of our legislative hearings, they said they've gotten everyone to sign that stupid consent agreement because they pressure you and they push you. And in fact, their attorney told me, you have no idea how bad we can make this for you. The threats are just intense, and you're like, "How am I gonna go up against this government agency?" But
Right.
together, we can make a difference. So legislators are very concerned about all the contract work they have to bring in. There's such a shortage of nurses, especially in Kansas, and so we've got all these rural areas of the state without coverage. The majority of our counties are considered underserved, and so I reached out to legislators with that message. And so the majority of counties are underserved, and you are bringing in contract labor for nurses from out of state, and you're spending millions, like over $40 million just for our state hospitals for
Yeah.
contract labor because we're so short. Meanwhile, you are eliminating nurses for clerical errors, the most de minimis minor offenses in our
Yeah.
state. And I said, and this is a popular issue because everybody knows and loves a nurse. This is important for
Correct.
even reelection because everybody knows and loves a nurse. This is a popular issue. And then when I talked to the media, it was this kind of the same story. Everybody knows and loves a nurse. And so I spoke to people who were running for governor and I got on their podcast because they're very interested in finding a popular issue. But
Mhm.
that really helped propel things. Once I got on a podcast for a governor candidate, then another governor candidate called me and wanted me on their podcast. And then the legislators are getting very interested at this point because they see there's like thousands of views of this. And it just propelled from there. And then after meeting with the speaker and with a couple of really key legislators, Representative Sandy Pickard is just dynamite. She's a retired nurse. She's really been fighting for our cause. Representative Christy Williams, Representative Dan Hawkins, and they said, okay, we're going to take the Board of Nursing. They're taking you to court. We're taking them to court. And so, yeah.
And boy, have they. And it has been pure
Hmm.
entertainment. You may have seen a video I posted, if you're listening, that I had clips of the hearing, and I will put links to the 2 days of hearing in the show notes for anyone. These are full 8-hour days. I listened to the whole thing. It is pure entertainment. I
Hmm.
mean, some of the things I have one of the quotes here. I think it was Representative Sean Tarwater, I believe,
Oh, yes. Oh, he's a
accused
rock star. Yeah.
so good. Oh my God, love him.
Hmm.
Accuse the Board of Nursing of being power hungry individuals that are ruining people's lives and having no regard for human life. And I was just cheering, like, yes, yeah,
Yes.
so
Well,
amazing. Okay, so tell us, I mean, what was it like testifying in front of the House Select Committee?
it was empowering. I mean, I enjoy public speaking anyway, but to finally be able to tell the story. And so many nurses have been silenced. And I'll be honest with you, when this first happened to me, I was embarrassed. I didn't want to tell people
Yes,
because I'm thinking, okay, I've got a public speaking career that is about to get trashed. When people find out that I'm labeled as unprofessional, I mean, it's going to be over for me. I'm not going to be able to find a job. And so I was trying to figure out how to solve the problem without being labeled as unprofessional, working with the Board of Nursing. I even offered at one point to surrender my license. I said, if I surrender my license, would you drop the case? Because once you label me as unprofessional, my options are so limited in life. I couldn't run for office. I can't do anything. And they said, no, if you try to do that, we'll take further action against you. I'm like, oh my gosh.
just
So,
pure
so when
retaliation.
oh, yes, yes. So when we finally got to the legislative process, I'm like, I'm ready. We're ready to fight. And once I figured out it wasn't about me, it was about the cause and not my case, then I was ready to go to battle. And I have no problem fighting for just causes. I've done it many times before, and I'm sure I'll continue to do it in the future. And so I was ready, and we had all these nurses behind us. The biggest challenge was getting nurses there because they are so
Yeah.
afraid. People at the very last minute would say, "I just know they're gonna take my license. I can't go. I can't go." Like,
Hmm.
"Hey, I'll go first. I'm sitting beside you. You can do this." And so I went first both times to try to be an encouragement. Another thing that was really important in those testimonies, and this is what I encourage other people to think about in your states, is the Board of Nursing's job is to protect the public. And so we
Yes.
brought in patients, a patient's family member, and that was key, and he talked about how the impact that his son faced when they lost access to their psychiatric nurse practitioner. And
Mhm.
there's so many, many cases like that, and dozens of patients have actually written letters to the Board of Nursing members saying, "You've caused us harm because you're taking away our nurses, you're taking away our nurse practitioners." And so they're not protecting the public, and that really came out in the hearings.
Yeah, your case absolutely revealed that you are not an isolated incident, and there are a lot in every state, a lot of nurses. And you're absolutely right that there is embarrassment and shame surrounding this. When I was reported, even though I knew I had done nothing wrong, and even though I was eventually cleared completely of it, there was shame, and I did not tell people that had happened, because the implication is you must have done something terrible. We need to start normalizing that because it's way more common than people realize. I promise you, anywhere that you're working right now, nurses, the nurse on the left and the right of you has been terminated unjustly at some point in their career out of pure retaliation or toxicity. And at least one of them has probably been reported to the board for something silly. It is
Mm.
so much more prevalent than you realize, and we need to normalize it and talk about it and detach the shame from it. But can you speak to some of the other egregious cases you're aware of? I know the one that you mentioned with the psych nurse practitioner. Hers, I believe she was the one that just accidentally clicked the wrong box during the renewal process. Can you talk about that?
Yes, she's an amazing psychiatric NP. Her name's Anna, and she's received awards and lots of accolades for her work with DCF children. She volunteers and just truly she's remarkable. She's kind of got this no nonsense approach where she's very direct with clients and they appreciate that. And we've just seen incredible outcomes. So she is renewing her license, and to renew your APRN license, you have to renew your RN and your APRN. Now, you can't renew both at the same time, which isn't that interesting. I mean,
Yeah.
this is such a gotcha. The way their whole system is set up is just a gotcha. So it'll ask you, do you want to renew your RN or your APRN? Well, you have to do both. So you click your RN, you go to another screen, you answer a set of questions, you go to another screen to pay. Then you come back to the home screen, click APRN, go to another screen, answer the same exact questions and then pay.
Okay.
So she does that, thinks that she's finished, oversees her in malpractice, everything else, and she's never been sued, record. Well, then 2 months later, a pharmacist calls her and says, I can't fill scripts for your patients anymore because you don't have a nurse practitioner license. She's like, what are you talking about? So she calls the Board of Nursing and they said, oh, when you renewed, you clicked the RN twice. And she's like, who would ever want to renew your RN license twice? Does that even make any sense? And she says, why
Yeah.
didn't you tell me? And they said, well, we
Mhm.
don't make it a habit of telling people.
So they're
So,
aware that it's
oh,
that it's clearly some stupid clerical
they
oversight,
knew. Yep.
and they can't even be bothered to, as a courtesy, reach out to the nurse and say, "Hey,
Well,
are
they
you
do
aware
for
of
some
this?"
nurses. They do for some. They don't for others.
Oh,
So in
so
that
it's not
first lineup of
equal.
tests, yeah, it's not equal. None of these disciplines are equal, and they have written that in their rules and regs that they can just decide arbitrarily from
Oh
case to
my
case
god.
who they want to discipline and who they don't. And so for some reason, she was picked to discipline, even though a really good friend of hers renewed the same exact month, did the same error, and no
What?
discipline for her. But in Anna's case, so then they said, you can't see patients now because you're not licensed. So she said, what, I'm a psych NP and I own my own practice. What do you want me to do with all my patients? I mean, they
Yeah.
can't go off these meds. I mean, that's dangerous. That's dangerous for them to go off cold turkey. And they said, well, just send them to the ER. And she's like, are you out of your mind? These people, it's taken them years to tell me about their rape or whatever else they went through. They're not gonna tell their story to an ER doctor who's
Yeah.
not in psych. I mean, this is just cruel. And so she's trying to find people to cover her patients, but we have such a shortage of psych providers in Kansas, such a shortage. She couldn't find them all care, and
Uh,
she cannot prescribe or see people. They wait like a month to reinstate her. So this is another part of the problem I want to bring up. Some people get reinstated right away while you're under the investigation. Like for me, it was just like 6 days or something. Some people,
okay.
they'll wait months before they
Yes.
reinstate you, even though they know they're going to, for just a clerical error. So now you can't work. But what they do it to try to pressure you to sign the consent agreement. So then after a month, they give her the consent agreement and they said, okay, we're going to renew your license. We're going to reinstate you. You just have to sign this consent agreement. Well, she's got to get back to work. I mean, her patients are struggling. She cares about these people a lot. If you talk to her, she weeps when they are hurt and they're injured. I mean, she really, really cares about her people. Plus, it gets worse. Her husband is a psych NP too, but he had a stroke a few years ago, and she's his primary caregiver. So she's
Oh.
taking care of all of the clients he took care of, plus her own. So
Oh
you
my god.
imagine all the people now who have no one. So she signs the consent agreement, and then her malpractice company drops her. Said, oh, you've been labeled unprofessional by the state of Kansas. We're dropping you. So she scrambles, finds another malpractice provider to cover her at 4 times the rate. 4 times. Who can afford that? I mean, she's paying as much in malpractice as a lot of people might pay for rent or a house payment. Um,
Wow.
then Blue Cross and Blue Shield drops her. They said, "You've been
Oh.
labeled professional, we're dropping you." And then United investigates her, and then it gets worse. The Board of Nursing says, "Oh, you're also licensed under the Behavioral Sciences Board." I think she does therapy too. So they turned her into the Behavioral Sciences Board as unprofessional.
Oh my
I mean, they
god.
just are attempting to crush her, just crush her. It's so, so wicked. I mean, I can tell you 100 cases. If you want to hear more, I could tell you some more that will just blow your
Yeah, yeah, tell me one of the more egregious
Okay.
ones.
So John Coslett, I knew John Coslett. I mean, he was the chief nursing officer, a man of incredible character and integrity, just stalwart. I mean, everybody who knew him had the highest level of respect for him. He was renewing his license, and as a chief nursing officer, you just get hours wherever you can, usually online. And so he had a lot of partial credit hours, like maybe there's
Hmm.
a half a credit here or 0.25. So, plus he'd have, larger amounts to just get his hours when he could. So he renews his license 2 months early, 2 months early. And they ask you, do you have 30 hours of CE? He clicks yes
Hmm.
and submits his payment, thinks he's done. Then, like a lot of us, he goes back and reads frequently asked questions and sees that for whatever reason, the Board of Nursing decided not to accept partial credits that year. I mean, they do now. They did before.
Wow.
For whatever reason, they're not accepting him that year. So here's a man of incredible integrity, contacts the Board of Nursing the next day and said, hey, I just want to let you know I renewed my license 2 months early. I said I had 30 hours, and he wasn't audited. He didn't have to do this. I
Yeah.
said I had 30 hours, but some of those hours were partial. I didn't know you weren't taking partial. I mean, you did before. I just didn't know. But I'm actually going to a conference, and I'll get all the hours that I need next week. So if you can just delay my application, I'll have all the hours. And they said, oh no, you already clicked submit. And they revoked his license. I'm not even joking.
And
Revoked
he
his
was still in the time frame. His license had not
I
lapsed yet. He
know,
did it
I
2
know
months
it.
early, so he was getting the CEUs within the
I
required
know.
time. That's
So
insane.
he was the chief nursing officer, so they were just shocked, but nobody believes you. And this is the thing too with my case, and people didn't believe me. They're like,
Yeah.
"There's no way the nursing board is coming after you for that. You had to have done something. We thought we knew you, but we must not have known you." I'm like, I promise you, I'm the most boring person I know. I haven't done anything that's exciting." But was the same way. He unfortunately passed a couple of years ago, and so his widow testified at that first hearing just at the effect, and his kids submitted written testimony. They said that, for the first time in their life, they saw their dad weeping. That was just so hard for him. He never really got over having his license revoked. And they put your name in the newsletter, and they left his name in there for a few cycles. And he kept
Oh,
calling
God.
saying, take my name off, take my name off. And I just think that there is this kind of I don't know.
It's a witch hunt.
It is a witch hunt. I think their theme song is "Another One Bites the Dust." I think the
It's
power
funny, but
hungry
it's not
mob.
funny.
I don't know. It's so confusing. But then the next person, they won't do anything to them. It's just so crazy.
No rhyme or reason to it. Let's go back to the unprofessional conduct
Yeah,
title. Why is this so problematic? What is I mean, I know, but what is included under the umbrella of unprofessional conduct? And
yeah,
you had mentioned that in your case, they would list you on 3 separate databases. Can
yeah.
you speak to that?
Sure. So unprofessional conduct is this kind of overall catching title that they give you, whether you have slept with a patient or sexually assaulted them or physically assaulted them, if you stole medications, or if you had a social media post that they didn't like. We had a nurse here in Kansas who they didn't like her social media post. So they said it was debasing an approved health practice or
Oh my
something.
god.
And so they came after her for unprofessional conduct too,
Wow.
or if it's practicing without a license. So it's kind of this catch-all phrase. Now, usually when after that title, it'll say unprofessional conduct, practicing without a license, So, but people aren't going to read all that legalese. They just see that you've been labeled as unprofessional, and that's a title
Yeah.
that sort of sticks with you. Now, the databases, so you are turned into the National Practitioner Database to nurses. And in the state of Kansas, you're put on their website. They list all discipline cases and they include your address. I even asked them, I said, please take off my address. I have taken care
That's
of
so
violence
unsafe.
offenders.
So
I do not
unsafe.
want my address
Yeah.
out there. And they said the only way we take off your address is if we had a court order. Like, you guys are wicked. But
They are.
it's interesting. They ended up agreeing to put my attorney's address on there instead of mine. I'm like, this is so ridiculous and pointless. So they put you on those databases, then plus the newsletter. However, here's the big one people don't realize. If your license is revoked, then you're
Uh-huh.
also on the Office of Inspector General, and that one gets really serious. That's where You can't be licensed to do other things. Like I couldn't
Anything
even be a
else.
hairdresser. I couldn't
Yeah.
sell insurance. And I don't even know if I could volunteer in my church nursery because I would be flagged on all background checks. It's really hard to get off of those databases if you're put on it. However, the Kansas legislator, they are going to be trying to pass laws to force the Board of Nursing to remove nurses who've had clerical errors or de minimis offenses off of
Yeah.
these databases. They are coming after them hard.
And I am here for every minute of it. Who thought in the beginning that it's a good idea to use this one catch-all term for every infraction, unprofessional conduct? So you have someone with a typo on their application online process under the same umbrella as someone who sexually assaulted a patient.
Yes.
Make it make sense. It's so ridiculous. We couldn't come up with another category or term, like misdemeanor felony. It's so insane.
Or create some kind of a diversion process so that you don't have to be reported to these databases. If it's a minor
Yes.
issue, just create a diversion process. I mean, there are a lot of nurses that have contacted me who really were practicing without a license and seeing patients. They weren't aware of it. But give them a diversion. They didn't hurt any patients. So this is not
Right.
malicious. And as soon as they recognize that they fixed it, the other thing is the Board of Nursing, it's a gotcha culture. They want to catch you. They don't inform you when you make a mistake because their goal is to catch you, and they make a lot of money doing that through the fines and the fees that they assess. There was one nurse, she put in the wrong credit card information. She's not alerted that she put in the wrong credit card information. No, it's not until later when she renews that they say, "Oh, you've been practicing without a license. You're unprofessional. You're on the databases. Give us money." Why wouldn't you send an alert that says this is the wrong credit card number, and you're typing it in on your phone? It's
Yeah.
insanity what's happening.
Yeah, and I really do feel that it is a witch hunt in many in
Yes.
many cases. It really is how it comes across, and it's so unnecessary. Many boards of nursing, I dare say probably all of them, really operate without any oversight. I've talked about this quite
Mhm,
a bit. What
mhm.
mechanisms are there any mechanisms currently that exist that you're aware of to hold boards of nursing accountable?
Yes, that is an excellent question. So if you submit a complaint against the Board of Nursing, guess who investigates it?
The
The Board of
board of
Nursing.
nursing.
Boss is guarding the hen house, and this doesn't work. Just human nature, power tends to concentrate. You know, and
Yes.
and so, power corrupts, and we're just seeing that. There's just no oversight. So I testified last year on behalf of a bill in the Senate that would give our elected officials oversight over the rules and regulations of the bureaucracies in Kansas. So we've got this kind of fourth branch of government, I call it, who are really sort of unchecked in our nation at the federal and the state level, and they can write their own rules and regs. And even when you go to court, like the administrative law judge, she's just was just trying to see, did they follow their own rules and regs? That's what her job is. But they wrote the
Yeah.
rules and regs, and they write them in such a way that they're always going to be the victor. And so
Yes.
you need, I think, people who are accountable to the public, which are our elected officials, because we can move them in and out of office, to
Mhm.
have oversight over the rules and regs. And that's one thing I told the legislature. I said, as legislators, you have a vested interest in keeping competent, caring, professional nurses licensed. This board has a competing interest. So you need
Yeah.
to have oversight over their rules and regs because they don't have the same concerns that you do.
They're omnipotent. They think they're God. Because they know they have no oversight. They know they can just act as judge, jury, and executioner for nurses, and there's no one there that's going to be watching or auditing or checking or holding them accountable. And just like you said, when someone puts in a complaint against the board, it goes right to the board. And
Right.
so
So one, we need constitutional amendments. So we're going to be voting on that in August in Kansas, and I will be speaking a lot to try to get that bill passed for people to vote for that constitutional amendment. But here's a second point too. I talked to the legislature about. Right now, the governor alone appoints all the board members and the executive director, and that's the way it is for most agencies. I really firmly believe that we need both sides of the aisle represented in these agencies, or at least
Mm-hmm.
just dispersed out. So maybe the governor has half of the appointments and the legislative body does the other half or something. But let's just get
Yeah.
a balance in there so that you don't just have one person putting all their friends together into that agency, and then they're gonna might be more like-minded. We need people who will push back. So I just like to see more diversity in those appointments.
Yeah. It can often be a good old boys club
Mhm.
with the board members in some cases. So what has this battle cost you personally in terms of finances, your career, the stress, the emotional toll?
Mm. It would be impossible to measure that. So I am unemployable right now. I've tried to get jobs, but no one's going to hire somebody who's under investigation because if I lose, then I could even lose my license. And at this point they're not threatening to take my license. However, the way the statutes are written, I will be, sent a bill for all of their court cost if I lose ultimately, and how would I ever be able to pay that? And when I can't pay that, then they'll revoke my license, and then I'll end up on the Office of Inspector General report, so that's kinda how that works. They also have the option, let me just say too, this is never over. So the way that they have written things in their rules and regs, they could drop my case for a while until public pressure dies down. And then 6 months or 5 years
Oh,
from now, they could say, lawyer up because we're coming after you again, even without any new evidence or any new issues or anything.
like the
They
Redon case.
they can
Yeah.
resurrect it at any point. So it's never over. It's never over until we get these rules and regs changed, which is again told me I had to fight. We have to fight this. This is so corrupt and unjust. You can't just think that you can play nice and just sue them over and everything's going to be okay. No, this power has to be taken away. We have to defang them. So I mean, it's been hard. So
Yeah.
financially, it's definitely a drain. My husband is fortunately, thank you, Jesus, he's doing really well. I mean, his cancer marker numbers have come down but he has to work a lot to support us. I'm still able to do some speaking engagements. So I do make money through some speaking engagements. I do volunteer as well. Um, but that, but financially, yeah, it's definitely been a stretch. And and I have to say, I mean, I wish this wasn't the case, but it's almost always in the back of my mind. So, I'm playing with my grandkids or just enjoying my family or in church worshiping, but it's still just back here. And I want to be done with this. I want to be rid of this. But when you're engaged in a fight like this, your mind is constantly trying to solve this problem. And I don't know, it just doesn't feel like it's ever gonna be over. And then, I hear these tragic stories of nurses daily, and my heart just aches, and I'm doing my best to help them, but that's heavy too. Feel free to contact me. I know you need to talk.
It is a lot, and you putting yourself out there is so it's risky and it's brave and heroic, and I applaud you. It's very courageous because, like you said, boards do basically have it written so that they reserve the right to reopen something at any later date for any old reason, and they don't even have to tell you why. And that's
Right,
what we saw happen with the Redon case with the Tennessee Board of Nursing. They, for no reason, reopened it after finding, in her favor and letting her work. And remember, if their purpose is to protect the public from potentially unsafe nurses, which it is, that's their purpose, and they let you go back to work and then they reinvestigate you later for some unknown reason, what does that say about their processes and
right,
what their goal is? Because if you're so unsafe, why did they let you go back to work?
right.
And I'm sure that this has probably translated into further retaliation. You're going public and the board now being called to the carpet for 2 days in front of the committee. Have you seen any other retaliation or threats?
Not yet. No, they don't
Okay.
communicate with me. Um they block my access to open board meetings. I tried to go. This was
Unbelievable.
before we had the oversight committee. I just wanted to go to the board meeting. I mean, once again, I guess a little Pollyanna, thinking that if I could just get in front of them, they could see me and I could talk to them. Maybe there would be
Yes.
reasonability. Before I went to the legislature, I even went to their investigation committee and said, "Can I just talk to you about a diversion process?" I investigated myself and I see that the majority of the licensing boards have that. I mean, I tried all of that. The only other thing they can do to me, I guess, would be to revoke my license. But you know what? They can't take my faith. They can't destroy my relationship with my husband, who's my favorite human. They can't do anything to my family.
You recently had a minor setback. The administrative judge ruled against you, claiming that the decision to discipline you was within the Kansas Board of Nursing's purview, within their rights. And that's all the purpose of that was, not to
Right.
listen to your entire case, but just were they allowed basically to discipline you according to the regulations? Do you
Right.
plan on appealing that? What's the status of
Yes.
everything with your case?
Yes, absolutely. So this judge said that she's not allowed to consider First Amendment rights or the constitutionality or the justness or the fact that they're not applying things evenly. It's just whether or not, according to their rules and breaks, if they could bring action against me. And so their claim against me is that I spoke at conferences
Yes. Can
during
you
that
tell
time.
us a little bit about that?
So, there are different conferences that, as a national public speaker, that I'm asked to speak at. And truly, non nurses and retired nurses also speak at these conferences.
Mhm.
So, people aren't getting CEs directly from me, they're getting it from the conference organizer. And so
Mhm.
during the time when my license was lapsed, they found an online calendar that showed the speeches that I was scheduled to speak at. And so that is their action against me. But as I said, at those conferences, there are non nurses or retired nurses who are also speaking on many of those same topics. So we will appeal to the judicial level. And I'm really prayerful that I will be able to get a pro bono group to join us. And so we've been talking
Okay.
there are a couple that I'm really hoping, like maybe the Kansas Justice Institute, the Pacific Law Group, because I'm not going to be able to afford, obviously, an attorney much longer to fight this, especially while I'm not employed and I'll run out of that malpractice writer. The Board of Nursing hears that, they're going to be thrilled. But I'm really prayerful that somebody, one of these pro bono groups, so if you're out there and you're a pro bono group, please consider joining. This is a First Amendment issue now, and there's a lot of groups
Right.
there that help fight on that First Amendment issue.
So basically, their claim, correct me if I'm wrong, is that you're practicing without a license during that time period because you're educating, you're providing
Yeah,
education at
I
speaking
wasn't
engagements.
delivering a care plan for a specific
Right.
patient or anything, just general knowledge on a topic. Um,
Right.
yeah, and
Which nurses do all day, every day. We are in the grocery store and we see someone with some alarming symptom, we go up, we feel compelled to say, "Hey, you might wanna get this checked out," and then you talk about whatever it could be. We do this at the soccer games, all day, every day. It's absolutely insane, and so, in your case, it sounds like they went looking for something.
mhm,
They went to your website, presumably, right, and
mhm,
fine-tooth combed it to
mhm.
try and find something to use
Yes,
against you.
yes, and that was in the call too, whenever they were trying to dig and find anything they could, which again, that was early on. I didn't understand what they were doing, and they said, "You volunteer and you speak a lot, don't you?" And I didn't understand that they were digging and trying to get
Right,
information, but
because 'cause they're
in
sneaky bastards.
they are. They are. You just have to be so careful what you say. I just assumed that they were friendly, and that was just not the case. Incidentally, they had said in the hearings, they said, our real concern is if a nurse knows that they're not licensed and they continue to practice, and this doesn't matter to them. But if you look at my calendar, there were no speeches from the time I became aware until the time I was reinstated. However, I would still I would still argue that, I didn't have a brain dump, and retired nurses or non-nurses can speak on the same topics that I speak on. I speak on a lot of leadership topics as well. So we'll just have to see what the district court says about this.
So you are appealing it to the district
Yes,
court. That's
yes, yes,
good.
can.
Good. I'm so impressed with your tenacity in this. If you could reform the Kansas Board of Nursing or any boards of nursing in general, what changes would you like to see implemented in maybe situations like yours? What do you think should
Yeah.
happen?
Okay, how much time do we have? So the
As
first
much as
thing
you
I
want.
would do is if you cared about keeping nurses licensed, you would combine automation with appreciation. I mean, your hairdresser notifies you when it's time to come back in for your haircut or your oil change. I
Yes.
would I would send text and email reminders and just say, "Thank you for 32 years of service. Want to remind you that your nursing license is coming renewal is coming up next month. Here's the link. Let us know if you have any problems in completing this process." Then I wouldn't allow a system that let you click on an RN renewal twice. That would just be an
Right.
automatic red box. You wouldn't be able to do it. If you put in the wrong credit card number, you wouldn't be able to progress to the payment page. I would put in all
Like
the
every other website.
yes. I would go to the private sector and I would try to see, what they've done this so successfully. I would probably try to send all the employees to Chick-fil-A to see how nice they are to clients and maybe we could translate this over.
Yeah, take a
But just
customer service class for the love of
customer
God.
service, my goodness. So those are a couple of things that I would put in place. There's so much. But I would also look at safe harbor. So nurses are working in
Yes.
horrific environments. And if you are working a double shift, taking care of twice as many patients as you're supposed to have, and you've been floated to another floor, that has to be considered when you make a mistake. My goodness, nurses, they carry all of the risk. And so I would look at safe harbor sort of issues.
Yes.
You think about maybe some kind of ombudsman process. I hate that we would even need that. But whenever you are accused by any of the licensing boards, maybe you've got somebody to help walk you through that. I would on the
Yeah.
consent agreement, it would be spelled out. If you sign this, you will go on these databases, and I would inform the nurse that all of this is about to happen to you so that they are making an informed decision in that situation.
Mhm.
I would have appointments for the Board of Nursing come, some from the governor, some from maybe the Speaker of the House, the President of the Senate, and the Majority Leader, just a variety so that you don't have it all from one pocket. Because I'm afraid you just get this cliquish friend group in there that we need somebody who will push back when things just are not reasonable.
You've got Barb and Ruth over there that
Yeah,
are drinking
Mary
coffee
Orland,
and thinking
yes,
of what way they can mess with nurses today. It's
yeah, it's
terrible.
right,
Those are
right,
great ideas, though. I love the idea of an intermediary, like an
yes.
ombudsman
And
for,
maybe an
nurses.
algorithm. So look at an algorithm between the difference between clerical errors, at-risk behaviors, and maliciousness. So all of us would
Yeah,
agree maliciousness, get them out of our profession. High-risk behaviors, they need to be disciplined too. But if you've got clerical de minimis errors, do not remove them from our profession. Do not
right.
create processes
How is that
that are going to
helping the
destroy the
public?
career. Yes,
Yeah,
I mean, I could go on for a long time, but there's a lot of things I would do.
those are great ideas. You mentioned safe harbor, and just so the listeners know, currently safe harbor only exists in 2 states. So if you're
Yes.
wondering what that is, it only is in Texas and New Mexico. I believe it was Pennsylvania recently had introduced some legislation. I don't know what the status of that is. But if you ever hear about anything in your state with safe harbor, you need absolutely to support it and get your representatives to support it. It basically provides a process for you as a nurse to safely report unsafe conditions without the fear of retaliation, and it carries more weight to it than you would think. So it's a great thing, but only in 2 states, sadly. You know. What advice would you give to nurses listening who might be afraid of standing up to their board when they know that there's something unkosher happening?
We need to act with wisdom and discernment. I encourage you, I mean, feel free to reach out to me if you like, amysiple.com, or reach out to Nurse Erica. So I would seek some counsel before you started that process because you want to exercise wisdom with that. And so those of us who've already gone through it can help you. But be courageous.
Yes.
We advocate for our patients. We stand for our patients when they can't stand. We speak for them when they can't speak, and we act on their behalf. I really think that's what nursing is. And we use our knowledge and skills to do that. We have to advocate for each other now. And if you are just concerned about just you, this is going to become a very dark world. Together, when we can stand up to Goliath if we stand together. But
Yes.
if you will not stand, nothing is going to change. And just because you think, oh, well, I'm safe because I just pacified them now, like we talked to you about, they can resurrect that at any time. If we don't get legislation passed to prohibit this, you don't know 5 years down the road that they're not going to resurrect this case.
Right.
Now for your Enema of the Week.
Let's take a moment to hear a word from our sponsors. This week's Enema of the Week award is brought to you by Happy Bum Co. Let's get real for a second. Your gut health affects everything: your energy, your skin, your mood, even how clearly you think. But here's the thing: most of us are walking around bloated, sluggish, and just not quite feeling our best. That's where Happy Bum Co. steps in. Happy Bum Co. has completely reinvented the way we think about cleansing and caring for our gut. Their all natural at home enema kits are not just about flushing out toxins, they're about restoring balance, improving digestion, and giving you that light, energized, ready to take on the world feeling. And unlike the old school intimidating methods that you might be picturing, Happy Bum Co. makes it simple. Their kits are actually beautifully designed, eco friendly, reusable, and come with step by step instructions so you always feel comfortable and confident. Plus, you can do it in the privacy of your own home. Thousands of people are discovering that taking charge of their gut health at home can be empowering, even life changing. Imagine waking up less bloated with more clarity, more energy, and yes, maybe even a little extra glow. That's the Happy Bum difference. So, whether you're looking to reset, detox, or just support your body in the most natural way possible, it's time to get your Happy Bum on. Visit happybumcode.com and use code NURSESUNCORKED for 15% off your first bundle. And see how easy it is to take control of your health from the bottom up. That's happybumcode.com, code NURSESUNCORKED. Because when your bum is happy, you're happy. This week's Enema of the Week award goes to Elliott Hospital in New Hampshire. I received an anonymous letter, presumably from a nurse at Elliott Hospital in New Hampshire. And so all of this is alleged secondhand information. But they went to enough trouble to make actually a cute little graphic of a dumpster fire with the name of the hospital over it. And this is specifically the emergency department, I believe. And they included some bullet points about why they are fed up with management. They even included an IRS form for their CEO's income. It said that they are fed up with the inadequate staffing, the over reliance on travelers, the poor retention and morale, and the absent and disengaged leadership. All while an absentee CEO is earning nearly $2 million a year. Yikes. I have to say, I'm not familiar with Elliott Hospital. I looked it up and it does appear to be in New Hampshire. Again, this is secondhand information. It is alleged, but I know nurses. And if they are going to the trouble to make a graphic, type all this up on a really aesthetic little flyer and send it to me via snail mail, then it's serious, right? They must be going through it there. So without a doubt, this week's Enema Award, so that I can support you all there at Elliott Hospital in the emergency department, goes to management administration at Elliott Hospital, New Hampshire. I mentioned in a recent video that I've been receiving a lot of anonymous mail recently, the last couple of months, to my P.O. box. And I am happy to be on the receiving end of anyone that just needs to vent or a safe place to send something. And so if that is you, I will list my P.O. box address in the episode description. Before we started recording this morning, you shared with me a story that I think would be impactful for nurses to hear about an example of a nurse taking their own life. Can you share that?
Yeah, I spoke yesterday about this issue to a group, and a woman came up to me and she said, I have to tell you that my friend, and she didn't tell me all the details, but she said she faced problems renewing her license with the Board of Nursing, and I think it was clerical, but she said she ended up taking her life over it. I mean, a lot of us, our identities can be wrapped up in what we do, our profession. If I ask you, who are you? You'd probably say, I'm a nurse. I mean, you start with that.
Correct. That's our
But
whole
then
identity. Yes.
but once that's taken away, I mean, so our identity has to transcend our profession. I'll say that's important too. But a lot of people are just being crushed. There was another gentleman that talked to me a couple days ago that, oh my goodness, they crushed him. My heart just aches for him. A gentleman who was licensed in Kansas. He has been working in the assisted living area. He received a great job offer in Florida. So this was as a health and wellness director, and then he was going to take his administrator's license and moving into administration. So he moves to Florida, is very successful doing that. He ends up with cancer. So he has to go on radiation treatments, and this assisted living so they wouldn't have to pay FMLA and everything. They ended up firing him. Meanwhile, while he's in this job, he doesn't need a nursing license to do this job. So he lets his license lapse because it's not required for this position and he sees himself in it forever. So he's
Okay.
terminated by his employer. He files a wrongful termination suit, but he's got to support his family. So he reaches back out to Kansas and they said, oh, your license lapsed. He says, yeah, but I wasn't working in a field that required a license. And here's evidence of that. And they said, oh, well, it's still lapsed. So sign this consent agreement. So he signs the consent agreement. They don't tell him what it means. And they just said, you can get your license reinstated if you sign this. So he signs it and he can't afford an attorney. He doesn't think he even needs one, of course. He ends up on the databases listed as unprofessional. Then the state of Kansas contacts the Florida Board of Nursing and says he's an unprofessional nurse because he's got a multi-state license. And so now he's not able to get licensed in Florida. He's working at 7-Eleven. He was making
Oh
100
my
a year, and now he's working at 7-Eleven. So you wonder why nurses would take their life. Imagine that. This man's trying to support his family working at 7-Eleven. I mean, and he's got cancer. I mean, this is just so egregious. If you have a multi-state license, if
Yeah, I
you are
was going to mention
disciplined in
this.
one state, the other states are going to discipline you too. So be
Yeah, and
careful
this is
on that.
something that nurses don't realize, and I don't think y'all are prepared to have this conversation, but I'm going to say something that's going to shock a lot of you out there. But it is not always in your best interest as a
Right.
nurse to hold multiple licenses. It very much comes back to bite you with boards of nursing issues. I've seen it time and time again, but I don't know if everyone wants to have that conversation yet.
Mhm.
Yeah. So one of the takeaways, just to make it really simplistic for people out there, is consent agreement. When you hear these terms, consent agreement, unprofessional conduct, these should immediately be red flags to you, no matter how innocuous it's being presented. That should be a red flag for you to pause, for you to ask questions, read everything, and probably get an attorney involved. Protect yourself. But finally, Amy, what do you want listeners to take away from your story? Not just about your fight, but the bigger problem in nursing regulation.
We have to stop eating our young. We
Yeah.
are serving patients during the most vulnerable states of their existence. This job is hard. It's really
Yeah.
hard. And I don't have to
Yeah.
tell any of you that. But we have to be there to support each other. We need to have each other's backs. Stop eating our young and treat your fellow nurse the way that you would treat your patient. Let's come alongside each other. Let's stand together when we see injustices, not just on behalf of our patients, but on behalf of other nurses too. If we stand together, think about how many nurses there are. we're a pretty formidable force if we would just stand together. So be courageous, do the right thing, let the cards fall where they may. We're going to stand together and we can make change.
Yeah, very, very important. And that should apply also to the nurses on boards of nursing, right? Stand by your nurses. You
Yeah.
can protect the public and also support nurses, right? Not mutually exclusive. Two things can be done at the same time. You can do both. Stand by your profession. You were once a nurse out there. And how would it be if it was you on the receiving end? How would you feel? I think ultimately your case it's huge. It's about a culture of punishment within boards of nursing and the broken investigative process that they use at boards of nursing. It really does apply across the board. It really does affect nurses in every single state. And I applaud you for fighting back, for taking the torch for nurses everywhere and trying to get this out in the open and not be ashamed of it and talk about it no matter what the outcome might be. I really do think that your case has the ability to change the trajectory of how nurses are hunted, for lack of a better term, sometimes by boards of nursing. So
Well,
thank you.
to God be the glory. I pray that that's the case. The cause is more important to me than my case at this point. And if we can help the next generation of nurses, I'm getting old. I'm towards the latter end of my career. I still could have given another good 15 years or so of service. But, if we can affect change for the next generation of nurses, that will be worth it. So it's just an honor to partner with you in this. I know that you have been talking about this and trying to make nurses aware, and we definitely need to increase awareness. Nurses need to understand this process so that they can just proceed through that investigative and disciplinary process with wisdom and discernment. Meanwhile, we need to change what's happening in our boards of nursing.
Yes, I agree. Thank you, Amy. Thank you for sharing your story and keep us updated on everything with your case.
My pleasure. Thank you, Erica.
That's it for this episode of Nurses Uncorked. If you've enjoyed this episode, please consider becoming a patron. There is a link in the show notes. And please sign up for automatic downloads no matter where you listen to podcasts. That goes a long way in helping out. And share Nurses Uncorked with your coworkers and your friends. Until next time, keep advocating, keep learning, and don't let the bastards grind you down. I'm Nurse Erica, and I thank you for listening.